Most of the people that I talk to about HIPAA, when I talk to them about it, they say that it really is just privacy or residence or agreements, disclosure, verbal stuff. That's HIPAA. I'll say, you got HIPAA covered? They're like, yeah, we got HIPAA covered. And I say, are you talking to your IT company? Are you talking to your IT people? They go, sorta. Well, then you don't have HIPAA covered. Here's what most people don't think about when they're thinking about HIPAA. Firewalls, devices, authentication. There is so much data traveling around, and I can tell you in any one of your organizations, if I were to install our logging and monitoring tools, my guess is we would collect anywhere between 8 and 15 million events per month. That's how much data is flowing around in all of your networks, and nobody has any idea. So there's 3 parts to HIPAA that I think are really important for you to understand. There's of course the privacy rule, which is our verbal, our written, and our access and disclosure of PHI, protected patient health information. There's also the security rule, and this is where I see a lot of people are lacking. Now this is your ePHI safeguard, so it's only electronic patient health information. The security rule only governs electronic patient health information. Remember that, because we're going to test you here in a minute. This is administrative, your policies, technical, your IT and your tools, and physical, that's your locations and your sites. That's how the security rule is broken down. And then of course there's the breach notification rule, and that's what happens when we fail either one of the other 2. So the security rule has 3 basic areas, as I was just saying. Administrative, that's who's responsible, what policies exist, and how people are trained on those policies. There's physical, that's how devices and spaces are physically secured. And then there's technical controls that protect access to systems and data. Ready to test your skills when it comes to HIPAA? We'll see what you guys know. I like to call this my HIPAA match game. So what we're gonna do is we're gonna run through 5 scenarios, and if this is a violation of the privacy rule, I want you to raise your left hand like this. Okay, so if you think this is a violation of the privacy rule, raise your left hand. If you think this is a violation, don't be too quick on me. If you think this is a security rule violation, put your right hand on your head. Okay, so privacy, left hand in the air, security, right hand on your head. All right, so the first one, a nurse talks about a resident's condition in the elevator. Is that privacy or security? Yep, that is a privacy rule violation. That one's easy. We started with an easy one. All right. Audit logging is enabled, but no periodic reviews of these logs are conducted. Yep, very good. That is a security rule violation, and it specifically violates the technical safeguard, which is we're required to log all of that access, and an administrative safeguard violation because we need to review it and respond to it. Next one. Your facility's security training is offered once a year, but it's not tracked or enforced. Is that privacy or security? You guys are good. That is a security rule violation, and it is an administrative safeguard violation because of lack of documentation, tracking, and enforcement. All right, this one's going to get a little bit harder. An unencrypted email with patient records is sent to a former staff member for input. Privacy or security? Yep, it is both. It's both. It's a technical safeguard violation because the email wasn't encrypted, and it's a privacy safeguard because it's a former employee. They don't need business having access to this data, right? We got to kick them out. They shouldn't have access to that data. All right, last one. A staff member leaves a computer unattended with a resident chart open on screen. Is that privacy or security? Just security. That is actually just security. Because remember, it's electronic patient health information, and that computer falls into locations, sites, and it's the data that was sitting on that computer. If it had been a printout on a desk, then it would have been the privacy rule, but because it's electronic, it falls into the security rule. Physical for the workstation use security, technical safeguard for controlling access, and administrative for the workforce security requirements that we have to have around the security rule. All right, you guys are pretty good.